It is my great pleasure to introduce Ms. Susan Steelman and Amanda Pizzolo from the UAMS Library Education and Research Services. Ms. Steelman received her master's in Library and Information Sciences from Louisiana State University in Baton Rouge prior to joining UAMS. She served as coordinator of our library's outreach services for several years, where she was responsible for maintaining our subcontract with the National Library of Medicine. She is currently a professor and chair of the Education and Research Services for the UAMS Library. Ms. Steelman holds numerous professional accolades, including distinguished membership of the Academy of Health Information Professionals, AHIP, past presidency of the South Central chapter of the Medical Library Association, member of the Journal of the Medical Library Association's editorial board. She has also been honored with the South Central chapter's Distinguished Service Award. Her research focuses on the role of librarians in facilitating literature searches, especially processes for conducting systemic reviews. Ms. Amanda Pizzolo is relatively new to UAMS. She is an instructor in the UAMS Library's Education and Research Services Department. She received her bachelor's in nursing from Clemson University and worked as a nurse in various inpatient and outpatient settings, primarily in the role of oncology infusion and bone marrow transplant, before obtaining her master's in Library and Information Sciences from Simmons University. She served as a metadata librarian at Amherst Colleges until 2019, but then returned to nursing in 2020 to work as a COVID tent nurse and later a tent commander. She joined UAMS and the UAMS Library in 2021. And of particular note, Amanda is the library liaison to the Psychiatric Research Institute. On a personal note, I've recently sought out both Susan and Amanda's expertise for conducting a systemic review, and I cannot stress enough, if you're thinking about doing a meta-analysis or a systemic review, check with them first to nail down your search terms, etc. You will save yourself a lot of time. So with that, I'm going to hand it over to Susan. Please take it away.
Thank you so much. And Amanda and I both would like to say thank you to Dr. Smith and Ms. Giblin for inviting us to present today at Psychiatric Grand Rounds. I am Susan Steelman. I'm head of the Education and Research Services Department. I've been at UAMS for 25 years, and can honestly say that we have always offered an amazing suite of services to our folks. Sometimes it's one of the best kept secrets on campus, unfortunately, but we're hoping to change that. We have found over the years that when a true partnership between librarian or informationist exists with the researcher or student or faculty member, it can lead to more efficient research. It can lead to better study time, greater effectiveness when utilizing the library's knowledge-based resources. And I hope after today, you'll have a greater understanding of how we can partner with you towards all of those goals. Amanda, you want to go to the disclosure slide? As you can see, we don't have anything to disclose. And at this point, I am going to turn over the presentation to Amanda Pizzolo and introduce her as the new library liaison to Department of Psychiatry and PRI. Take it away, Amanda.
All right, great. Thank you, Andy, and thank you, Susan. And just to make sure nothing changed on me, y'all are still seeing this main screen with the mouse moving, right? Okay, great. Okay, so we'll get right into it. I'm going to talk a little bit about objectives now for today's presentation. We will primarily focus on discussing all the different library services, especially highlighting the ones that will be most useful for you. And then at the end of the presentation, I'm also going to tell you about some general tools that you can access through the library that will be useful, and some resources and tools that are especially useful for any publication needs that you may have. So before we go into the services, you need to know who can use them. Let me just move this. There we go. So most folks, when you ask them who can use the library, they will immediately think of that we're for the students. And we are for the students, both as a place for study and group collaboration, as well as for research and instruction. But we do serve all mission arms of UAMS here at UAMS Library. So when you ask who can use the library, you might be surprised by how many people are included in that list. First and foremost, our primary clientele is always UAMS personnel, whether it be that faculty, staff, residents, fellows, researchers, and UAMS students in the pursuit of knowledge and learning. We also serve any licensed healthcare professional in the state of Arkansas, either directly at the UAMS library or through one of our UAMS regional centers. Excuse me. We also, through outreach activities, work with a lot of other libraries in Arkansas, be they public, other medical libraries, special libraries, or academic libraries. And then this one's especially not widely known, but pre-COVID times, when we're not in COVID restrictions, the public are welcome to the UAMS library, and we serve any Arkansan needing to do health and medical research. So again, when it's not COVID restriction times, any Arkansan can visit us in person and utilize our health and medical collection on site. When it's not COVID, they can come anytime that we're open, but we do highly encourage them to come Monday to Friday, 8 to 5, because that's when our department, for Susan and I, that's Education and Research Services, that's when those faculty are here. So we'd be able to provide them with in-depth assistance in using our biomedical collections and consumer health resources. And if you can't tell, we're really looking forward to resuming that service. Now, a quick overview of kind of the traditional library services that we have here. Our library collections are designed to meet the education, research, service, and patient care missions of UAMS. Nowadays, most of our collections are primarily electronic, be that e-journals, e-books, multimedia tools, or web-based resources. But we do also have a lot of physical things. So we have over 53,000 electronic journal titles that you can get access to through our resources. About 10,200 of those are specific to medicine and health research. We also have over 42,000 books in all formats, and that includes over 19,000 in electronic format and about 23,000 in print format. We have 115 electronic databases that you can access, and we have about 510 physical journals. And then our library is staffed by 12 professional librarians and 11 FTE paraprofessionals and technical staff. As far as circulation goes, for any of the electronic collections I just mentioned, all you'll need if you're off campus is your UAMS user ID and password. We'll talk more about that later. But you can access any of our electronic resources through our website. And then for any physical items that you want to check out, you just use your UAMS ID badge as your library card to check out things from the library. And then also we do extend our reference and borrowing privileges to healthcare practitioners throughout Arkansas, either directly again through us or through our UAMS regional center libraries. Now this interlibrary loans piece, or ILL, no library can collect every quality item or subscribe to every journal that you might need. So this is where the wonder of ILL comes into play. We are a part of the network of the National Library of Medicine, and that enables us to fill requests for materials from across the country. So even if we don't subscribe to a journal that has an article that you need, don't let that stop you. You can make an ILL request for a journal article, and that's usually completed within 1 to 2 business days, or sometimes even within just hours. And you'll get an email from our ILL department with instructions on how to access the electronic version of that article once they've completed their request. All you have to do is sign up for that through our website, and it is free of charge to you because the library covers most of the charges for ILL, and also there's no limit on the number of requests that you can make. And then finally, the Historical Research Center, that's on the 5th floor of the library. They have an amazing collection of books, journals, and artifacts documenting the history of health sciences in Arkansas. And they're also home to the UAMS archives. Excellent staff, amazing resources. Come visit and check it out anytime. They also have several online collections that you can access right through their website. This photograph, for instance, is from one of their online collections, and it is a photograph that was digitized of an oil painting of Dr. Elizabeth Fletcher, who was the first female physician at the state hospital, and she taught psychiatry at UAMS from around 1928 to 1954. Along with a lot of other things that she did in her life, but this is just one example of the neat collections that they have. Now, those are kind of the traditional overall library services. Now we're going to delve into the services that my department and Susan's departments provides. We are Education and Research Services, or ENRS, and we are the most forward-facing unit of the library. So in addition to providing point-of-need services, the 7 faculty members that make up our department can be found across campus working with liaison groups, as members of campus committees, IPE facilitators, and more. In terms of those point-of-need services that I mentioned, we do provide reference services. So we respond to walk-in, email, or call-in questions, whether they be brief factual questions or questions about how to access an article, how to find health-related information, or how to use one of the resources provided by the library. We also have a long tradition, I briefly mentioned this, but about 40 years, over 40 years actually, of engaging in outreach services to the state. In the past, we've worked with the Arkansas Department of Health, public libraries, and licensed healthcare professionals in different outreach activities. We actually have a new outreach services librarian who started in February, Andrea Hayes, and she will specifically focus on outreach, but all of the faculty in ENRS do participate in outreach. And then all of the other services that we have bolded here, we're actually going to go into each of these in more detail. So firstly, our liaison services. This is, as Susan mentioned, and as Andy mentioned, this is an area that we're expanding. Liaisons are library faculty assigned as needed to UAMS colleges, clinical units, and various research departments on campus. This is how we ended up here today to present to y'all. As they mentioned, I've recently been assigned as the library liaison to the Department of Psychiatry and PRI, and I am really looking forward to working with all of you. As your library liaison, so a couple things I can do. I am happy to set up any auto alerts for research topics that you have, so managing your NCBI alerts. I will also send email updates on new resources that the library offers that will especially pertain to you. And then the other big aspect is I can provide all of these other services for you, but also I can just be your point person as a connection to all the services that you can access within the library. So instead of having to go through another route, you can come right to me if you have an idea for how we can help, or if there's a specific service that you want to access, I can help you get to it. So some of those different services, and we're going to talk about all these as we go through the presentation. You may want a consultation or help with specialized search strategy development. If you're looking to have an orientation or presentation or training, to have a librarian teach a class as part of your curriculum, or if you need assistance with scholarly publishing or copyright or fair use questions. Now, the other aspect of liaison services that is great is that the more that I work with y'all and know about your particular needs, the better I can give good input when it comes to collection management decisions here at the library. So the more I know about what you need, the better I can assess if the journal subscriptions we have are suiting your needs, and if not, what we can do to fill in the gaps. Or if there's a new tool or resource, for instance, that we should investigate that would be particularly useful to PRI. So the more we work together, the better we can make sure the library is serving you and collecting what you need. And just another thing to mention with liaison, and we'll talk about this again in a minute, but we are also returning to our house call services. So there's lots of different ways to meet with us, whether it's in person here in the library or over Zoom or some other virtual format. But we're also now returning to where we will come to researchers and faculty to provide our services directly to you in your lab or office. And we are very happy to take our show on the road. So. Now on to the education services provided by ENRS. This kind of arm of our services, really of our department, encompasses all different types of education. So one-on-one, group instruction, small group, and both education of our students, but education for any other UAMS folks as well. So in terms of the one-on-one or small group assistance, We provide that in the form of consultations. They can be in person or via a platform like Zoom. All UAMS students, faculty, and staff can request a consultation, and we will try to fit as much as possible to your schedule when scheduling that. Just so you know, for this consultation, this patron consented to having their picture taken. I'm not just randomly taking pictures during consultations that you have with me, so don't worry about that. Now, a lot of times, so why might you want a consultation with a librarian? It can be for all different sorts of things. A lot of the times it's when folks want assistance with searching for articles on a topic or refining their search strategy. We all come, the faculty here that work here, we all come to ENRS with a lot of literature searching experience. But then we go through a really extensive full year of expert searcher training that I will mention again soon. But that really hones our skills so we can provide the best service possible when it comes to searching. We've also had consults with folks to help them find all the articles related to a certain grant or to discuss systematic review strategies, really anything that a faculty member, student, or staff member needs our help with that can't just be solved with a quick reference answer, we can do a consultation. Now, in terms of larger group instruction, some topics that we're happy to provide instruction on to your classes or in smaller group settings are database searching, literature analysis, and bibliographic management. And if you're teaching a class, we can work with you to provide library instruction that is tailored particularly to your curriculum. I am, in addition to being your liaison, I'm also the academic health sciences librarian. So I'm a great go-to to talk about how we can tailor instruction for you. And we definitely want to provide that. Our education offerings aren't just there for the students, though. We also provide instruction services for researchers and their teams. Those requests might be for advanced searching classes, how to use RefWorks, or how to avoid predatory publishers. And as I mentioned, we are returning to house calls, so this applies to education as well. Whether it is larger group instruction or a consultation service, we will bring it to you. You can request either a consult or a class with the same form. On the library's main page, the Start Your Search menu, you will see me reference this a lot throughout this presentation because it has a lot of great quick links to things on here. One of them is the Request a Librarian Appointment, and that will lead you to a form that you fill out to request a consultation or a class. And Susan's also going to drop a link, a direct link to this form in the chat box for you. Now, while we're talking about education, I just want to also mention that we're currently beefing up our on-demand education video options available through the UAMS YouTube channel. There's a UAMS library playlist on the YouTube channel. We've added more videos even since I took this screenshot just a week ago. These videos aren't a replacement for our full classes or consultations, but you can't, because it's not interactive and they're much shorter. Everything is under 10 minutes here. The quick tips are usually under 2 minutes. However, these are great for like a brief introduction to a topic, or if you just want a quick how-to on how to request an item through ILL, that kind of thing. These are definitely something to check out. Susan's also going to drop a link to our library tutorials page that has all of these videos on it and links to the YouTube channel. And she's going to drop a link to the YouTube channel itself. And just so you know, on that, either just by contacting me or through that library tutorials page, you can submit a request for a tutorial. So again, if you have an idea for a topic that you'd like to see in this format, please let me know. So moving on to the next arm of our ENRS services is research and clinical search services. So since the library's inception, we've provided in-depth research, reference assistance and literature searches for all of our faculty, staff, residents, and fellows. And in 2007, we started a more formalized service that encompasses highly specialized services. So since then, our research and clinical search services has grown as word is spread across campus. And we currently average around somewhere in between 380 to 400 searches a year that we do for UAMS faculty and staff. These searches are only conducted by our expert searches, and what it means to be an expert searcher, I touched on that briefly before when I said it takes about a year of training, which it does. We get extensive training in clinical and biomedical resources, database and vendor systems, controlled vocabularies, search methodologies, publishing, and more. So by the end of it, we've got a lot of searching experience, and we really want you to take advantage of our expertise when it comes to literature searching. The RCSS searches are free, and we can run searches for topics at all levels. So if you need a lit search for background material, for a grant proposal, or for a paper that you're writing, if you are looking for material, background material to help with patient care, maybe you're prepping for a talk that you're about to give, and you want to know the most recent research trends in that area, we can provide those basic searches all the way up to in-depth research for patient care cases, as I mentioned, or for full-blown systematic reviews and meta-analyses. And we'll talk more about that aspect in just a minute. Now, come promotion and tenure time, we do provide unique searches for information needed for promotion packets. So we can verify your citations to ensure complete and accurate citation info is in your CV. We can also conduct searches to identify who is citing your publications, and we can take your publications and pull the impact factor of those particular journals in which they were published for you. So we'll do all that as a part of our P&T services. Another, excuse me. Another unique RCSS activity is the support that we provide towards compliance with the NIH public access policy. So UAMS research librarians have been involved with the National Library of Medicine pilot to increase compliance with NIH public access policy since the policy became law in 2008. We were actually one of just 3 libraries, with Boston University Medical Center and Harvard being the other 2, that participated in a pilot project to increase compliance. And since then, we have created customized compliance reports that we provide to individual departments and the VC for research, and we provide assistance and guidance to any PI needing to meet compliance. We also have a lot of great information on our webpage about not just the NIH public access policy, but also the other federal agencies that you might get funding from their public access policies. Now, to access any of the services I've mentioned, so if you're looking, you want to do a lit search request, on that same start your search menu that I just showed you where the request librarian appointment was, right below that there is request literature search, or actually it's called literature search request. Or if it's something that you want to discuss with a librarian, whether it's about your search topic or it's about what we can do for promotion and tenure or the public access policy compliance, then you could request a librarian appointment for a consultation, or again, reach out to me and I can connect you. Now, to touch more specifically on literature reviews and the systematic review part that I mentioned, we get a lot of requests for searches needed for systematic reviews or meta-analyses. Sometimes people do use the phrase systematic review to indicate that they just want a comprehensive literature search on a given topic in support of a review article. In biomedical literature, the term systematic review is used to mean a specific type of journal article with a standard structure and process. And such systematic reviews are usually about a narrow clinical topic, like comparing randomized controlled trials of various drug therapies. Whenever we get a request like this, we will set up an extensive consultation with the primary investigator and/or the entire research team to identify the team's search needs and final goals for the search. Often when the systematic review meta-analysis process is explained, another type of literature review might be chosen due to time constraints or team size. A particular favorite is to do a scoping review, whereby the goal is to identify concepts or themes covered in articles and map the gaps in research. But whatever the case may be, we can talk with you about what type of literature review that you want to do. We actually even give presentations about the different types of literature reviews if you're interested in that. And if you do want to pursue, and we can do literature searches for whatever literature review level you're doing. And then if you are, if your research team is going to be doing a systematic review, you may actually be interested in having a librarian embedded on that research team. And having a librarian as a part of that, this is just an example of all the different types of services that a librarian can provide when they are part of a systematic review team. So this is just, another example of the library's dedication to interprofessional collaborations on campus. We do have this handout. This is just a screenshot of a handout that we have available on our website. Susan just dropped a link to the page that has this handout on it, if you're interested in seeing that just in more detail. Moving on to another arm of ENRS is our clinical librarian services. This is another area where we are expanding. So Lindsay Blake, who was already a clinical librarian here, is now the coordinator of that department or of that area. And we have an additional clinical librarian, Lauren Tong, who recently joined us. I can tell you, so the first time I saw a clinical librarian, I was not even considering librarianship as a career for myself. I was working in bone marrow transplant, and I saw a clinical librarian rounding with our physicians. And so I can really attest to it really was impressive. The value that was added by having them there really was just highlighted for me in that instance. So generally, clinical librarians will round with one or more departments in the hospital to provide real-time education to residents and students on the use of medical literature resources and applying evidence-based principles. Some services offered by our clinical librarians might include attending morning report and providing review articles or a summary of the topic or questions that arose during report. They might be presenting at noon conference regarding literature searching, evidence-based practice, or research basics. And they may attend patient rounds, whether that's accompanying the team or being in a room with the team, on rounds to help answer point of care questions, assist residents and students in finding and using evidence-based information, and provide in-depth research on complex questions. In terms of services offered to residents, they can give assistance with scholarly projects, papers, or posters. And then for faculty and clinicians, they might partner with you on presentations, publications, grant funding, and research to provide more comprehensive information for you while you're doing these projects so that clinicians can devote their time back to patient care as much as possible. Now, I touched on embedded librarians a little bit when I mentioned the systematic review thing, but just to elaborate on that. So for the past 15 years, we've really seen a shift of health science librarians stepping out of traditional roles. So we still provide reference services, but it's no longer the main service that we provide or really what's taking up the most time in our day. It is the request for specialized classes, consultations, and then having librarians involved at the point of need. It's really becoming the norm. And as a part of that, embedded librarians are also becoming more popular. In our department, we focus on two types of embedded services. So on the curriculum side, excuse me, librarians can be embedded within specific classes, and that creates the opportunity to integrate our services and customize them to the student and instructor's needs for that class. And this is even more important as more classes move to online formats. And then on the research side, embedded librarians are those that are assigned to work with specific research teams at UAMS. It might be a short-term project or a longer-term research undertaking. I mentioned the systematic review process. You may want a librarian embedded on that, but that is by no means the only type of research project that it can be useful to have a librarian embedded on your team. A lot of times, the librarian on these teams becomes a partner in the project to the point of co-authorship responsibilities. And if you do have a project planned or just have one starting now that you think you may want a librarian embedded on, I would encourage you to go ahead and contact us, because the benefits of having a librarian inserted on a research team are much greater when we're in on discussions from the start. But we're happy to help in any way that we can. And thank y'all for, I'm going to go to the next thing now. Y'all have had to listen to me talk about services a lot here, but I just want you to know that there's a lot that we can do. If you have an idea for another service that we can, or a way we can partner with you that you didn't see discussed here, definitely still reach out to me, let me know. But now I'm going to show you some general tools that you can access through the library that will be useful. First and foremost is something that you probably don't even think of as a tool, but it is something that we provide that will be especially useful for you, and that is remote access to all of our resources. So that allows you to use a proxy service so that UAMS employees and students and anybody with a UAMS username and password can access the library's licensed electronic resources from off campus via the library website. And this, like I said, it's available for anybody with UAMS or UAMS affiliated folks at ACH, or if you're at a regional center, any UAMS faculty, staff, resident, med student. If you're in a regional center, as long as you have a UAMS email address, you'll be able to access our resources. So this is just an example workflow here of what it will look like if you're off campus. So we'll talk more about this in just a second, but you always want to start from the UAMS Library's homepage to access any of our resources. Many of them you can't access in any other way because we're paying for that service. But even with something like PubMed that you could get to from outside of the library, you still want to access it through the library, because when you get to an article that you want to see the full text for, if you've accessed it through the library, then you will see a check for UAMS full text button, and we'll see that in closer detail in just a second. If you click on that, you get one of two options. If you have one that says full text online, you'll click on that, and this is when, if you're off campus, you will be prompted to log in. Then you log in and you're all set. You'll get to the full text. One pro tip is that if you've had to do this and you're off campus, keep that same browser window open where you logged in as you access other databases and everything else, so you don't have to keep logging in. Just to look at those things I just mentioned in closer detail. So this is the whole reason for accessing PubMed through the library's website, is that will allow you to see this check for UAMS full text gold icon. In other databases, this icon may look different. So this is an example in PsycInfo or any EBSCO database. It'll say check article linker. In Web of Science, it says search for UAMS full text, I think. But basically look around for a link like this. If you want to access the full text of an article, click on it, and then you're going to get one of two options. So if we subscribe to the journal where that article is, you will get an option where you can click on full text online, and you'll be led to it. But even if you get this one that says, sorry, this item is not available online, you can still, like I said before, request it through interlibrary loan. That is free of charge to you, and there's unlimited amount of requests. So don't let this screen stop you. You can just click right here on request via interlibrary loan. The very first time you use interlibrary loan, you do have to sign up for it, but then after that, you're good to go. Another great tool for you to know about is browsing. So browsing allows you to browse, read and follow thousands of scholarly journals available at browsing.com or from apps or Android and iOS mobile devices. So you can access it desktop, tablet, phone, lots of different platforms and devices. It brings together journal content from multiple publishers and platforms into a single place, and you can save your favorite journals, and you can view the tables of contents of any journal that's in there, and then you can also read or save articles as new issues are released. You can search for a journal in browsing by just looking up the title of the journal, but you can also look by subject, which is a really great aspect. So here, this is just a clipping from me being on the site. You can look at all the journals in psychiatry in this subject, and then you can also look by subfields as well to see the journals that it has listed there. Another cool aspect of browsing is that you can create your own free account in here, and then you can basically favorite journals and organize them differently so that you can quickly access and keep up to date with your favorite journals. This is actually an example of Susan's bookshelf here. So when you're logged in, you can have up to 4 bookcases, up to 16 shelves, and up to 64 favorited journal titles. And that just allows you to quickly access and see what's new in your journals. This is what it looks like to view a journal's table of contents in browsing. So you can see if you've got an account, you can add this to your bookshelf to favorite it. You can also just navigate to an issue by the year, volume, and issue number, and then you'll see a table of contents here. If you do see an article that you want to read the full text, you can click on it, and again, you'll be led to that same screen we saw that, you know, if you click on the check for UAMS full text when you're in PubMed, for instance, you'll either immediately be led to full text of that article, or you'll be led to a screen that allows you to request it through ILL. If you're not interested just in the full text though from here, you could also export a citation or share a link to the article via email, Facebook, LinkedIn, or Twitter. Now to get to browsing, again, it's that same old start your search menu here on the UAMS library homepage. Browsing is under e-journals by subject there. That's just so if somebody isn't familiar with what browsing is, they can still say, oh, okay, I'm interested in looking at e-journals by subject, and they'll get to it. You can also get to browsing by going to A to Z digital resources and then just searching by name. So there'll be an alphabet. Once you get to that page, you can click on the B, scroll to browsing. And this is great to know about in general because this is, you can get to any of our databases, any of our electronic or digital resources right through this screen here, and you just access them, go to them by their name. Now, another tool that the library provides that's good to know about is through one of our databases, Web of Science. So not only is Web of Science our second major science database, but it also is the gold standard for cited reference searching. Come time for promotion and tenure packets, using this time cited tool that's available in Web of Science can enable you to find the number of times your articles have been cited by other authors, so it can be really useful. We've got a citation pulled up here in Web of Science, and you'll see just over to the right, it provides you with the time cited. Now, even outside of just trying to know the times your article has been cited, you can also click on this to see other articles that have cited this article, and that can be really helpful just when you're looking at, you want to find other relevant articles on the same topic. One quick note though, if you're using this as a stat for the time cited, it is the times this article was cited by other articles that are in the Web of Science core collection. Web of Science can't see all the articles outside of it to know any time ever that this article was cited, but this is still really useful because the Web of Science core collection is so in depth as well. Another great thing that you can access through Web of Science is a journal's impact factor. So if you have search results pulled up here underneath each citation, if you click on the name of the journal and you're in Web of Science, a little box will pop up and it will show you the most recent annual Clarivate impact factor and the 5-year rolling average impact factor, and then some ranking information about this journal. The most recent annual one will always be 2 years previous, just because of the way they calculate impact factors. And this is, a lot of folks will be familiar with impact factor, but this is a useful tool for evaluating the impact of a journal and assessing its quality. Not the only one, but a useful one. Now, on that note about assessing a journal's quality, if you are getting ready to submit a manuscript and you're looking for what journal that you want to publish in, we can provide services on that. We do in-depth consultations on it. We can give presentations on avoiding predatory publishers, all sorts of things with this. And we also have a great guide on our webpage. We have an overall publishing and copyright guide, and within that we have Find a Quality Journal. Susan's going to drop a link to this in the chat. She just did on it. On this page we have a journal checklist that you can use as you're assessing journals. And we have links to all these resources that I'm just going to quickly run through here. So one of the first step really on assessing a journal's quality is usually Ulrich's Periodicals Directory. That's a database that has bibliographic and publisher information on over 300,000 periodicals. It provides data points for specific journal titles like publisher, country of publication, peer-reviewed status, indexing, and much more. There's also DOAJ, the Directory of Open Access Journals, and that's a database that lists open access scientific and scholarly journals that agree to follow the principles of transparency and best practice in scholarly publishing. And they have those principles available on their website. There's Eigenfactors, another great resource to know about. So they have their own impact factors. They're calculated in a very similar way to the ones we saw in Web of Science. So you can find impact factors and related journal information for sciences and social sciences journals through there. Jane is a really cool tool. So Jane is Journal Author Name Estimator, and this can be great if you're looking for what journal to publish in based on what the subject that you wrote about. So if you go there, you can actually drop in your manuscript's title and or abstract, and then it utilizes PubMed data to generate a list of possible journals, and that data includes eigenfactor rankings for those journals. It'll also show you if a title is indexed for Medline, which is a top quality indicator, and it will label any journals that are DOAJ journals. And then finally, one that a lot of folks don't know about, but it can be great, is WorldCat. That is like the library catalog to end all library catalogs. So you can search for a journal in here and you can see what libraries in the state, nationally, and internationally hold that journal. So that can be just another way to see the potential impact of a journal, because most folks are accessing journals through library subscriptions. And also it tells you a little bit, because libraries are having to pay for journals, so it tells you a little bit about the value of journal based on how many libraries hold that journal. Another great tool to use when you are researching journals is thinkchecksubmit.org. They also have a checklist that you can use while you're assessing journals. They have some great tips on what to think about before you are even going into the journal assessment, and then some information about when it comes to submission time. One of the things in the think category there, and one of the things we always encourage you to do is, before you even start looking at journals, is think about your goals for publishing. You've spent a lot of time working on this manuscript. You don't want it to be wasted time because, for instance, you publish with somebody where it's not easily discoverable. So for instance, just because an article is online now, if it is not, say, available through a database like PubMed or PsycInfo, whatever the case may be, where people are searching for articles, it's not very discoverable. So these are just some questions to think about beforehand, to know what your goals are for publishing. And again, like I said, this is something we can do consultations on and presentations on, so definitely take advantage of us with this. Lastly, I just want to point out that we have lots of good things on our website. So there's all the tools and databases that I've mentioned through our website, but there is also a lot of just guides and contents available to you through our website. So we have, for instance, a publishing and copyright guide. You can also look at our resource guides by subject. For example, this is the Research and Scholarly Activity Guide, and you can see that each of these has multiple pages within it with lots of good contact information, lots of good content and information, and contact information for a librarian with more on that topic. So I want to end here so we have some time for questions. We have my direct contact information, Susan's direct contact information, our ENRS contact information, and again, reminder links for that literature search request or consult or class request. And I will just briefly mention here too, if you do email the reference desk, these forms kind of prompt you to put in some details about yourself, like what department you're in, that kind of thing. If you do ever just directly email the reference desk, it's always good to put in like your signature in the email so we know where you're from and that you're UAMS affiliated and all that good stuff. But anyway, if anyone has questions, feel free to drop them in the chat or unmute yourself and ask us now.
Thank you for the presentation. I'll go ahead and lead us off. You mentioned, I'm impressed that the library will be willing to help with conducting lit searches, specifically for grant applications. What's the lead time for a request like that? About how much time would you need to start doing a project like that? And does it vary from grant cycle to grant cycle, deadline to deadline?
Yeah, that's a great question. So usually any of our literature search requests, there is an option on the form for you to put a date due. We, if you don't do that, our default is generally to try to have it done within 3 business days. If your one lit search request actually has like 4 different topics in it, or it's particularly complicated, it may be a little longer than that, but usually we try to do around 3 days for each individual lit search request.
Wow, that's impressive. That's incredible. Any other questions? Could you tell us more about a scoping review? Like, what is the process? I'm not familiar. I don't want to get off topic, but I've never heard of that type of review. How do you go about identifying gaps in the field?
Yeah, that's a great question. I'm actually going to I'm working on just starting the beginning of my own scoping review, but Susan has more experience with actually doing them. So I'll let Susan answer that one because it is a good one.
Yeah, scoping reviews are very useful as far as process goes. When I'm doing a scoping review, I use a very similar process as if I were doing a systematic review. You know, I do in-depth consultations with the research team, trying to identify what it is they want to specifically focus on with the search, and then to really start mining uh, the research team's professional knowledge for terminology, for synonyms, for everything we can do to pull together to make a comprehensive search. But it is up to the research team to identify what the scope of the search is going to be. So if they're looking at a surgical technique that is only been around for 5 years, then maybe we're only looking at 5 years. But we try to do a very general, broad search while still focused in on what they want to focus in on. But then with the results, it's more a mapping of themes that keep showing up in the literature. And if theme A breaks off into these other themes, just trying to identify that, and then identifying where there are holes in the research. So I really find scoping reviews very useful in, you get to know what's out there on a particular topic, but then you also get to know what's not there research wise, and that may give you ideas about future research projects if you can really identify where there are holes. So as far as process, everything's the same. We document every single part of the search process. Every database that we run is documented. And quite often the librarian is included as a full member of the team, writing the manuscript method section on how the searching was done, included as a co-author. And depending on the journal, for a scoping review, they may or may not want the full Medline strategy in the actual publication.
Okay, thank you.
Mm-hmm.
Any other questions? You can unmute yourselves or post them in the chat bar. Don't be shy. Oh, I see some praise. I agree. This has been amazing. Thank you so much for sharing with us. Oh, I have one more question. What can we do to support the library? These are some tremendous services. So how can we help you help us, I guess?
Well, I'll take that one. There's so many ways. I mean, for one thing, really getting on board with communicating with us, letting us know what the best way to communicate with you is. We're hoping as we beef up these liaison services that having a person to go to when a name and a face that you become familiar with, and that person gets to know your specific areas of research within the department and within the institute, so that we can be more proactive about serving up things, because we all get like updates and we're included in national news sources and things like that. So when I see something come across that I know is pertinent to, I'll give you an example. I'm on the IACUC. if I see something come across one of my feeds that deals with animal research, I automatically send it to that team and committee so that they are aware of something. And it may have come from a resource they never saw.
Mhm.
So from your side, one of the best things you could be doing to help us is use our services, for one. Let us save you time, effort, but also being willing to communicate to us and participate if we're asking for input back on particular collections or resources. If there are journals that we're subscribing to that you don't find useful, let us know. If there are others you wish we had, let us know. And just help us improve that communication back and forth. A lot of journals that we get are in package deals. Many folks don't know that our library goes to great extent and has for decades worked with other consortia, with academic libraries, other medical libraries. So because when we buy as a group, we quite often can save a whole lot of money on journal subscriptions. So if we can keep that going, we want to, but we also don't want to be spending money on things that you don't find absolutely useful in your subject area. So those are a few suggestions I have.
Thank you. This has been a wonderful talk. If we have any additional questions, we have your email information. Thank you again so much. It's been a wonderful presentation.
Thank y'all so much.
Thank y'all very much. We appreciate your time.
Have a great day, everybody.
Yes, take care.
Thanks.
Bye-bye.